Health Association, and I'm pleased to welcome you to today's webinar. We're really excited about partnering with HHS on their We Can Do This campaign. The purpose of this campaign is to increase public awareness and public confidence in COVID-19 vaccines, and to educate the public about the availability of COVID treatments while certainly reinforcing basic prevention measures. So if we could make sure the slides are up. I want to do a little bit of housekeeping. I point out this webinar will be recorded, and the recording and transcript will be available at www.youtube.com/user/APHA-DC. That's youtube.com/user/APHA-DC. So hopefully those of you who want to take another look at this or want to share this with others can certainly share that link with them. So here's our agenda today. We're going to talk, first of all, kind of where we are now, who continues to be at risk as this pandemic begins to transition. Talk about prevention methods. Obviously, that's the basis of public health. Testing, treatment, the campaign itself, and what APHA is doing to promote COVID prevention, testing, and treatment. Talk about some of the challenges we go forward, and then take some questions for you. We've got about an hour to accomplish that. So, as we all know, we've been doing this for about 3 years now. We're 3 years into this pandemic, and as you can see, we've gone through various surges in which the virus has impacted our communities more and more. But on whole, we're now seeing those surges diminish very much in size. As you can see, we have had a very dramatic reduction in the number of people who are both hospitalized and tragically die from this disease. And clearly, that's because of many of our public health measures. I think we, as a public health community, ought to acknowledge the fact that we've saved a lot of lives based on the efforts that we've done over the last 3 years, but also recognize the fact that we still have a ways to go. And while all pandemics at some point kind of come to an end, as we say, but the disease itself doesn't go away. In fact, smallpox is one of the few diseases, and the only real disease that we've actually gotten rid of that primarily infects humans. Reminding you who's at risk. Right now, it tends to be older individuals, complicated by those people who have chronic diseases, regardless of age. So heart disease, lung disease, cancer, anything that ultimately impacts your immune system plays a big role in putting you more at risk. And we also know that if you get infected, it also tends to be people who are racial and ethnic minority groups, people with disabilities, because of the exposure aspect of that, as well as the disproportionate aspect of having many of these chronic diseases. But I think the way to think about this right now is the older you are and the more underlying diseases you have, the much more you're at risk for this disease. And you should take that in assessment as we go along our daily lives and as we try to return our society to normal. Clearly, public health believes very strongly in prevention. So I can't overemphasize the importance of getting your prime vaccine series and getting boosted. That is the best way to provide the best protection. Wearing a mask when appropriate, in appropriate settings. I actually have a mask that I carry around with me. I wear it around my neck when I'm outside. I put it up in appropriate settings, and I continue to encourage people to wear a tight-fitting mask as an additional layer of protection in the appropriate settings. Obviously, continue to wash our hands, just because respiratory diseases continue to be prevalent in our society beyond COVID. All the various respiratory diseases that we have is very important. Staying at home if you're sick and getting appropriately tested for COVID-19 in the right settings. And of course, if you have COVID-19, we really continue to emphasize seeking treatment right away, because one of the things that we've discovered is that people who have COVID are not getting the treatment in a timely way. And we can do a much better job at doing that. Obviously, anyone who gets symptoms should get tested. As you know, the respiratory symptoms are pretty vague. It's sore throat, it's cough, it's URI-like symptoms, muscle fatigue. Your proximity app goes off on your phone. We still have many of the states that have proximity apps, and people are still being notified. And you go to a meeting and you get notified that someone at that meeting had a positive test. You should follow the guidelines and get tested, usually within the first 4 or 5 days of your symptoms. And if you're negative and you continue to have symptoms, we always suggest you retest yourself. And there's still an abundance of self-tests out there, so getting tested really should not be a barrier for most of us today. We know there's still some challenges in ensuring equal access to treatment, and we know we need to improve that. We know that we have patients that just don't really know the severity of their illness and its risks. They may not be aware of the treatment availability. And in fact, the treatment is best done and gives you the best benefit if begun within the first few days of symptom onset or your positive test. So we want to make sure that as part of our discussion today, we express the importance of anyone who's not been vaccinated, anyone who gets symptoms, even if they're vaccinated, to go through the testing and treatment process if they turn positive as a way of diminishing their risk. We know that things like vaccination, we know that early treatment all impact and reduce the risk of long COVID. That's the chronic syndrome that we see from a small but important population of individuals who do get COVID-19. So the federal We Can Do This campaign is designed to incentivize and educate the public. It's a program of the Department of Health and Human Services. It is a nationwide initiative to increase public confidence. And you may see there are other organizations like APHA that are promoting this program. But the goal is to continue to raise public confidence in these vaccines, which we know are very safe and effective, to talk a bit about the continued availability of treatments with antiviral agents as a way to reduce the morbidity and mortality from this terrible disease. And we know that, over 2,000 people continue to be hospitalized every week from COVID. And we know that a substantial number of people continue to pass away, to die from the COVID of disease. And as I mentioned earlier, age is the strongest risk factor for severe COVID, and people of any age with those underlying medical conditions we talked about are also at increased risk. So we want people to understand their risks for severe illness, do kind of a personal inventory about their underlying disease and health status, and then have a plan of what you do if you're positive from COVID. There are a whole range of educational materials on treatment. You go to the APHA website, you can find this. They're at the apha.org We Can Do It site, and you can print these out on our website. So we want to encourage everyone to go to our site and use those materials. One of the great things I get to do today is have the honor of also introducing our immediate past president, Dr. Kay Bender. Many of you know Kay. Kay is a former deputy health officer. She is a very staunch, well-known public health official. For many years, she ran the Public Health Accreditation Board. And with that, Kay, I'm going to turn it over to you.
Thank you, Dr. Benjamin, and it is a pleasure to be with you today. I know many of us have become a little weary about talking about COVID, but as Dr. B said, it isn't over, and we need to continue with our vigilance. APHA has been helping people understand COVID since the beginning, and certainly promoting the need for equity in prevention, in testing, and in treatment strategies and efforts. APHA has offered more than 25 webinars like this one on COVID, consistently spoken with the media, and used social media to educate people on the importance of prevention, to encourage vaccinations, testing, and treatment for those infected. The We Can Do This campaign is a great next step in our efforts in the need to keep reminding people that COVID is still causing illness and death. I know I've seen the We Can Do This public service announcements and commercials, if you will, on our local television, and I've been really impressed with the quality. Next slide, please. To reach public health professionals and some that are giving direct care to patients, APHA is reaching out regularly to share information about the We Can Do This campaign and its resources with our 25,000 members, members of our state affiliates, and tens of thousands of other contacts that we know are interested and need information on COVID. We've also shared information with organizations that we've partnered with in the past, and we've asked them to share it with their contacts. We've done this through emails, blog posts, social media, and of course, the APHA website. 9 of our state affiliates are making a concerted effort to share the resources with their local contacts and networks. And they've been posting on social media and emailing contacts. We in Mississippi are starting our annual conference later today, and we will be talking about the We Can Do This campaign and encouraging our 300 plus individuals that will attend this conference to go to the APHA website and look at the resources and share them. Next slide, please. As Dr. Benjamin said, that COVID-19 prevention is basically the same. Get vaccinated, get boosted. Those are the prevention efforts. Their vaccines are still the best and greatest prevention tool for COVID, along with a lot of other diseases like flu and pneumonia. TV commercials by Pfizer with rock stars like Pink, with Olympic champions like Michael Phelps, and with others like Gene Smart and Questlove, who's one of my favorite musicians, also help with this effort to get people to seek treatment. Wearing the mask, washing our hands, staying at home if we're sick, getting tested for COVID, which is much easier to do now than it was 3 years ago. And if you have COVID, seeking treatment right away. Those basic messages are basic public health. They're evidence-based, and they are certainly the message that all of us need to continue to promote. Next slide, please. A study published on March the 23rd in JAMA, Journal of American Medical Association Internal Medicine, shows that early treatment with Paxlovid reduces the risk of long COVID by 26%, reduces the risk of death by 46%, and hospitalization by 24%. I know that on our own television stations, one of the more popular messages coming across are people that other people recognize to say, If it's COVID, it's Paxlovid. And that sort of catchy theme has certainly provided us with bumper sticker, elevator speech kind of messages that we can give. One of the things, though, that is troubling is this same study noted that only 12.67% of those eligible for treatment received it. And we need to dive more into whether it was lack of awareness about Paxlovid, whether it's an equity issue and access to care, and especially to Paxlovid, or whether we're still dealing with some resistance to treatment, as we've seen all through the 3 years. We're going to talk about that some more in the next slide. So there have been now a number of studies all across frontline workers, and particularly in the nursing literature, which of course you would expect I read a lot. But I think the studies about the nurses could equally apply to any of you who've been frontline dealing with COVID. A recent study that was done by some colleagues, Dr. Karen Robinson and her colleagues in North Dakota, really compared how we as frontline workers, particularly nurses, feel about this whole pandemic, compared it with the effects of war. That there's a certain amount of PTSD type symptoms that, you know, many of the frontline workers, especially nurses, have experienced. And so because of that, there is this desire for normalcy. Let's get on with life already. There is a certain amount of COVID fatigue. And we are still dealing with vaccine hesitancy, even among some of our nursing, medical, and other public health colleagues. And that, for me, is probably the most frustrating to deal with. Vaccines, as you all know well, have a long history of efficacy against vaccine preventable diseases, and yet somehow the pandemic messages to some extent are still out there that the vaccine's not safe, that you've heard all of those. And so we still have a role to play in talking about, yes, they are, and yes, it's important. And of course, a lot of that has to do with the politics. In my 40 plus years of practicing public health, I've never seen a public health issue other than maybe reproductive health become so politically charged as COVID has. And we're still dealing with the aftermath of that. It's still, I saw a tweet the other day from a leader, an elected official who is a leader, who said it is, you know, this whole COVID thing is still some kind of conspiracy, and we need to be really careful, he said, to not fall into that trap. Those of us who are public health professionals need to be able to craft our messages and get past our COVID fatigue ourselves and be able to use campaigns like the one we're talking about today to get past those political messages and put the evidence out there for people to see and to understand. And of course, all of that wrapped up in our ongoing and continued desire for equitable access to testing, to treatment, and to care. Next slide, please. As you all know, the emergency declarations related to COVID will end on May the 11th of this year. When that happens, the single payer system that we've had access to deal with COVID funding will end, and we'll go back to the patchwork of insurance plan that we rely on for our other health issues. This will change people's access, and equity will become a bigger issue. We need to remain vigilant. We need to remain committed, and we need to remain single on our message that access to test, vaccine, and treatment for everybody, and especially the uninsured, needs to continue. We don't need to be doing this in a haphazard way. The uninsured need a plan. And I know in many ways we're preaching to the choir, to our APHA audience, but it's never so important as it is with COVID. We've lost over 6 million people to COVID already. And so we don't need to continue that trend when it's preventable. Next slide, please. I want to close as we get to the Q&A by saying that the study that I mentioned earlier about the battle of COVID being in the nursing frontline worker world compared to warlike battle in their own backyard ended with a recommendation that to move forward, that nurses need evidence-based support strategies. And I believe that that's true for not just nurses, but any of us who are working continuously to prevent further morbidity and mortality from COVID. This particular campaign that we're talking about today has those evidence-based strategies. And the good news is we don't have to go and do a search beyond apha.org to look up those evidence-based strategies. They are available there. And I would just encourage my colleagues to pull them up. Let's get our third or fourth wind, whatever it is, and continue our vigilance about the COVID-19 and its prevention. So with that, Dr. B, I'll turn it back to you, and I believe we can take questions.
Yeah, thank you very, very much, everyone. And I just want to just give you the website again, the apha.org/we-can-do-this site for folks to get the resources and ultimately a link to the recording for our webinar. So with that, we can certainly begin to take some questions. I know I saw that we had a question here from Olivia Cortopocais. Olivia, good to hear from you. And I know that you had a question about vaccinations, particularly for seniors. And I believe that the recommendation for CDC is obviously for people to get their primary series and then to get the one bivalent shot. Whether or not there are going to be additional recommendations coming down the pike, I think still remains to be seen. As you know, just today, actually I think yesterday, CDC verified that that was the recommendation for the one vaccination, and they're not yet ready to recommend that we get additional vaccinations, even if you're a little bit beyond the 6-month period. So right now, that is the recommendation. I anticipate when CDC and FDA sit down in about another month and look at the situation worldwide, and particularly in the United States, they'll be able to either validate the current recommendation or they may make additional recommendations, but that's the recommendation, I think, as we understand it today. I think that one of the questions also in the chat was about some of the main barriers for preventing at-risk people from getting or receiving early treatment for COVID. Kay, did you want to maybe comment on that a little bit more, a little more detail?
Yeah, I think that at least in some of the case studies I've read, and even in my own experience, you know, especially this time of the year, right? We all have allergies and sinus issues and what we call the spring common cold and that sort of thing. So I think some of the barriers to getting early treatment and particularly to be able to qualify for Paxlovid is we postpone getting that test. I know I can name several people that I've known who've just thought it was their usual spring, whatever, upper respiratory kind of thing, and they postponed it until they got really, really sick. And then, of course, in some cases, too late for Pavloxacin to really do much good. So I've been trying to encourage people, if nothing else, test yourself at home. I mean, that's the one thing, and I know that's probably a little bit controversial, but if nothing else, rather than postpone, do that home test. They're easy, they're affordable, they're free for a lot of people. I know I've been on several university campuses lately where they're just free to students and faculty. I've been in community health centers where they make those tests free, and then of course you can order them as well. Even doing a home test can give you some indication perhaps of whether it's COVID or not. And then if it is, you know, we need to encourage people to seek treatment. If they're not able to do a home test, then I think we should be encouraging people to just not overlook signs and symptoms. It may just be allergies or sinus or common sinusitis or common cold. But what if you lost by contacting your primary care provider and getting a test? You know, maybe a little time and whatever, but it may mean your life in the long run. The other population, as Dr. B. mentioned earlier with the other question, that I've seen a reluctance is with the elderly. And I know many of our elderly are active and, you know, our older adults, they're out and about, but many of them are not. And it's just a lot of effort to make an appointment to go be tested or to seek treatment. So I know in our state, we have incorporated these messages about get tested so you can get treated and get vaccinated if you need to and boosted. We've incorporated that into our healthy aging community work so that we're talking about this at churches, at senior adult centers, at other places where senior adults or older adults are beginning to gather again. And so I think a lot of the barriers are those. The other thing is the reality is trying to get in to see a primary care provider can sometimes take weeks or days. And so what at least I've seen in my nursing practice is if somebody can do that a home test and have some indication that it might be positive, that will very often break a barrier for being able to get in and get treated. But yes. Dr. B, you may have some other thoughts.
No, okay, I'll build on that, and I agree with you. And I think that, look, there's still lots of self-tests around. I know that I still have several in my cabinet. You want to make sure that they're still current and haven't
Right.
expired. But there's still tests around. And as we transition to away from the public health emergency, and the tests will become less and less free and available. We still have a repository of that, and there are many people that still have those tests. There's, as Kay said, a lot of the schools are still testing and have tests around. So I think and we know that from a scientific perspective, the viability and sensitivity and specificity of those self-tests are still pretty good, despite the variation in the virus through different strains. For those of you who need to get a PCR test, and those may be more difficult to get, and they certainly may be more expensive in terms of paying out of pocket. I think, again, as Dr. Bender said, have a plan. And part of that plan should be, what do I do if I get positive, and what's my relationship with my doctor, and figure out whether or not they can do a televisit for you. Many offices now allow you to send them an email, share with them your situation, and they can either get you in the office if they need to see you, or prescribe this. And we still have the test to treat programs in many communities that some of the retail pharmacies. So identifying a test to treat site also is another option for folks as we go forward. I think one of the changes we certainly going to see is for those people who want to get tested and who are symptomatic. I would assume it's going to be just like any other medical test. You know, you'll go through you'll call your physician, you'll call your healthcare provider, the nurse practitioner caring for you, and they'll authorize you getting tested, even if you don't have a self-test at home. If it turns out that you want to get tested because you're getting ready to go to a meeting or some other situation where you have to pay out of pocket to get the test because the insurer will not cover it, and we don't know exactly what all the rules for all the various insurers will be. But again, I think everyone should contact their insurer and find out exactly what their process will be to manage both vaccinations, testing, and access to antivirals like Paxlovid. And so I think it's going to be very important for people to have that plan up front and just not assume what's going to happen. And that way, once you know, you can easily navigate the system, again, because we're going to be going through a little more complicated system we're very familiar with, but obviously one very different than we've really gone through for the last few years.
I think one of the biggest things that we as public health professionals can do is to keep this on the minds of people so they can develop that plan. And it really is easier to leave COVID in the past, but COVID didn't stay in the past. It's still walking along with us. So this really becomes a good opportunity while we're not really in a pandemic mode for public health professionals to speak in their communities, wherever people gather, to make sure that they have this information, that they understand that we're about to undergo another series of changes in how access to testing and treatment may be available. But the basic message that vaccinations, boosting, early testing and treatment, masking, social distancing, and what nurses love the most, and that is Florence Nightingale's still right that hand washing is still important. We need to be doing those things anyway. And so while we're not in this battle with the pandemic itself and trying to respond to that, is a great opportunity for us to do some education. And again, you don't have to craft the message. You might want to customize the message to your local community, but the messages themselves and the science behind them are all there for you in this campaign.
I think one of the other things we want to do, Kay, is deal with this whole issue of misinformation. And yes, there's still lots of bad information out there. And I think I've always argued the way you address misinformation or disinformation is with the facts, and become a trusted messenger and continue to try to maintain the trust of the people that we're working with by giving them good information. And if you give people the wrong information, to correct that information and then own up that, yep, I misspoke, I said the wrong information, here's the right information. I think the other thing we have to do is continue to articulate how things are changing over time. So, for example, we know that Paxlovid is very effective. And, I think the biggest complaint about the medication from people that have taken it is that it does give you a funny taste for a while. Yeah. And, but it does not disproportionately give people breakthrough infections. That's a good piece of evidence that we've just figured out that it really doesn't. So that it's an effective medication, and looking long term, it does seem to reduce the incidence of long COVID. Now that's what we know today, and again, I'll try to document and speak the way I'm learning over time. Is that that's what we know today, and then we may get new information tomorrow about that, but that's what we know best today. And that long COVID, we're treating people fundamentally symptomatically for the various symptoms. There's a range of groups that are studying long COVID, trying to make sure we have a good case definition for long COVID. But we're only 3 years into this brand new disease, so there's still a ways to go.
Yeah, it's a great opportunity to bring back up the fact that they call this a novel coronavirus for a reason. Novel means new, and new means that we don't know everything because we've not experienced this virus exactly like this in the past. The other thing that I would say is, while I am a real champion, I think people who know me know this, of public health professionals being out front, being very clear, as you said, about the changes in the latest information and making sure that it's factual. I think that campaigns like this one are also really good when we can engage with respected community leaders. We talked about on the national level this campaign engaging Michael Phelps and Pink and Questlove and others, but you can also do that in your state and in your local community. We have several television, radio, social media announcements running here in our state right now with trusted individuals, people people are not in medicine or science necessarily, but who people respect. People who play sports. People like Morgan Freeman, who are from Mississippi, and others. So I think it's also a time when we can walk the talk that we always mention about how important it is for public health professionals to have trusted partners and stakeholders in the community. And we can give them the messages, and then they can tailor it and take it to audiences who may actually listen to them in ways they may not listen to some of us because they hear us all the time.
I think one of the other questions in the box was about the transition to the public health emergency. And of course, a lot of things were tagged onto the public health emergency, both the broader emergency at the presidential level, as well as the HHS Secretary's declaration. It will have impacts on data collection. We know that CDC is working to enhance our ability and the continuous ability to get the appropriate data through our various public health surveillance systems. We know that it will have impact on the clinical side with testing for people who don't have insurance coverage. But again, there's not going to happen right away, and we will see some tapering in the availability of testing, and again, having a plan. We have invested a lot in community health centers and efforts to address individuals who need to have access to care. So we should make sure that all the safety net systems that we put in place during COVID, that we continue to engage in them, continue to invest in them, continue to advocate for adequate resources for those programs, to continue to make sure people have access to testing, to vaccinations, and to care. I think one of the biggest concerns we have, which actually starts April 1st, is the redetermination process for people on Medicaid coverage. Cheers to North Carolina for expanding Medicaid, but we still have 10 states that haven't quite gotten there yet. But there will be some transition. We know that there'll be millions of people who will be up for redetermination. Some will maintain their Medicaid coverage, some will lose their Medicaid coverage. They may well be able to transition into the health exchanges. They may be able to get coverage in their jobs. So there'll be a range of movement in terms of people's access to care and the way they're covered for care. That will change. And there'll be some societal things that will change. To the extent Title 42, the immigration aspect is tied to this. I think that remains to be seen what will actually happen with that. But there's a range of other issues that public health has been involved in that we will have to be addressed. But fundamentally, the healthcare part of this should be pretty solid. And I know, again, that the department is working very hard to make sure that the uninsured in particular still have access to appropriate testing, vaccinations, and treatment programs. But it is going to be up to all of us to make sure that we are working with our communities to make sure that that happens.
Yeah, I don't think any of us want to see a repeat of outbreak to the extent that so many people are out of work and businesses are affected, because the workforce in many businesses is still not back to normal, as we know. And if we take steps backward, once the emergency declaration funds are no longer available, then shame on us for not having learned here. We've got systems issues to consider, policy issues, and certainly access and equity is just, to me, and I know a lot of people have said this, COVID shined a light on inequities in ways that, we knew were there, but just really brought them to the forefront. And I hope that we learned enough about that, that as our communities are working with public health officials and others on their equity issues, that the COVID story gets wrapped up into that work. We talk a lot about institutionalizing, and that's probably a terrible word, but institutionalizing evidence-based practices so that, they just become part of the fabric of who we are and what we do. And there isn't really, unless, as Dr. B said, something changes and we learn more, the whole story about get vaccinated, get boosted, wear a mask, stay home if you're sick, wash your hands, don't be around other people too closely, get tested, get treatment. That's basic public health 101. And yet we know that with COVID, as we said, the whole political climate, the whole equity climate, access, all of that continues to be a challenge for us, but we have a lot of good examples from other programs and areas in public health where we've remained strong and we've continued to advocate and we've folded in whatever the prevention message was into many of our other bodies of work in public health. And so I hope, and my challenge to all of us is, as we work on our public health infrastructure and our workforce, that the whole prevention around COVID and the whole issue of access to just basic public health, basic health care for the prevention and treatment of COVID becomes part of our public health fabric.
Thanks, Kay. Cindy Chin is asking us if you've tested positive for COVID again with moderate symptoms, should you take Paxlovid again? So let's box that into two pieces. I know the answer to one, I don't know the answer to the second part. The first part is that in general, people don't recommend that if you have a rebound case of COVID that you should be retreated with Paxlovid. But there are some studies that are looking at that. And so stay tuned, we may have different information as those studies can continue to be done. The second question is, you totally recover from a case of COVID, and then, months later, you get a second case of COVID. And the question is then, should you be treated with Paxlovid? And the answer is, I don't know definitively whether or not you should or not. I would anticipate that the answer to that is probably yes. It's not real technically a rebound case, but my advice would be for you to check with your clinician on that at that time. Another question we have is how the transition to home testing will impact COVID surveillance. So yeah, it's it's dramatically, when we went to the self-test, it's dramatically undermined our ability to have a system where every test that's positive we kind of know about, because every test that's positive had to go through a health department or a practitioner or some system to actually get the test. And so when we went to allowing people to self-test, we lost that basic system, but we still have a good surveillance system out there. I mean, CDC still has just like we do with influenza and other infectious diseases, we have a baseline surveillance system. So they can get a sense of whether or not the epidemic is going up or going down in general. They have a sense of testing for variants and changes of the variants, and they've made that a much more robust system. So we should be able to identify when a new variant enters the community within a reasonable period of time. Again, that's an assessment that I think we've learned from the pandemic itself. But we don't test every case of influenza. We don't pick up every case of many infectious diseases. We do things based on estimates, based on surveillance systems. And so that's probably how we're going to be tracking SARS-CoV-2 and as we go forward. Remember, we're actually tracking the virus and we're tracking cases. So we're going to be tracking those things as we go forward. It does take some of the specificity out of it for sure, but I think that's going to be our future in terms of how we actually track this disease. Also, remember, this is a global pandemic. And with that, there are other nations in which are getting data as well. They have the same challenges we have as they go to self-test. And so this is going to be a much bigger tracking process than we've certainly done for this kind of disease in the past, I would anticipate. Okay. Are there any other questions out there? I think we've gone through the questions.
Oh, Dr. Pitchman, while you're looking, I would also bring up a related topic in this whole sort of next phase of COVID, and that is so many of our frontline workers, whether it's in the healthcare system or the public health system, really have faced some significant mental health challenges as a result of just the stress of going through the history of the pandemic when it was first started and there were no tests and rules were changing and systems were challenged. Some systems rose to the occasion better than others. And I know several frontline nurses and physicians and respiratory therapists that I know well just said they just felt abandoned during that time. And after it kept going on, and then they saw people not being willing to take the vaccine or wear a mask or whatever for prevention, and it was just a tough time. And we're in one of those nursing shortage cycles that we go through periodically, a perfect storm of baby boomers finally retiring, and all, but also we've lost a number of nurses and other frontline workers from COVID. So I think while we are talking to our communities and encouraging them to be vaccinated and boosted and all of these other things, I would hope we would also remember that we still have colleagues all across the country who are still struggling with mental and behavioral health aspects post the first part of COVID. I'm not going to say post-COVID since we still have it. So I would hope that we would also encourage our colleagues to talk about their stories, to be able to feel comfortable saying, you know, I'm not okay yet about this. Maybe they lost a number of family members. Maybe they lost co-workers. Maybe they just left their job altogether. But I'm struck by the fact that we can't really carry these messages to our communities if we're still hurting ourselves. So I think we have to address these multifaceted feelings that many of our APHA members and our other colleagues have experienced and also continue to experience, and encourage them to take care of themselves so they can be there to provide education, information to their communities and families. It's a little off topic from the campaign, but I do think it is at the heart of what some of our colleagues are able to do next in using these resources from this wonderful campaign is they have to be okay themselves in order to move to this next phase.
Thank you, Kay. I think that is so important because we know that the stress and the mental health aspect of this pandemic have been enormous through all communities. There's a few comments in the chat. One, I was reminded that we have many communities still have wastewater surveillance systems, which will be very helpful. A question about people with autism getting vaccinated, and yes, absolutely. That in itself is not a contraindication, but obviously everyone should check with their provider if they have any questions or concerns. And when we iterate, the vaccine does not cause autism. The issue is whether or not someone has an underlying allergy or some other reason that any patient, any individual, but the reasons for medically not getting vaccinated are very, very, very small. that there's still a fair amount of money out there from the appropriations, and the schools are working on improving their ventilation systems, and we should remind people that that they should do that. And then I continue to remind people that that mask wearing is another part of our protection, and you know, not wearing a mask is the least protective. In fact, you're unprotected, even if vaccinated. Wearing a multiply mask provides the next layer of protection. Wearing an N95 mask gives you the best protection, but all of these are only good as well-fitting as the mask is, and not your nose hanging out, your mouth hanging out. The mask needs to be well-fitting. And I think, as I mentioned earlier, wearing that mask in appropriate settings where you feel you may be more at risk. You're going to a party, you're going to an event, and wearing a mask reduces your risk. And I would encourage all of us to accept our friends and colleagues who want to wear a mask. Even if you choose not to, they choose to, that we should obviously respect their perspective. I've actually had people look at me kind of weird when I've worn a mask in communities where there is not a high degree or has not been a high degree of mask wearing in their community. And I just encourage people to obviously respect all of our wishes to protect ourselves as best we possibly can. And that makes a lot of sense. And starting with getting fully vaccinated, and most likely we'll be looking at the bivalent vaccine as going forward. And we will know for sure what the makeup of the vaccine will be, certainly in a couple months, as the CDC and FDA looks at both the makeup of the vaccine as well as the periodicity of the vaccine. At least that's the current plan, is to do that. So stay tuned. I think, again, this is still an evolving situation, and we should all recognize that what we advise people to do today may be augmented as we learn more and understand more. Kay, you have any final comments?
Yeah, to that end, I would say, I've heard healthcare providers and some public health professionals say, I'm tired of COVID. I don't want to go to another webinar, another workshop. I don't want to read another article. And I get it. We talked about COVID fatigue. But as Dr. Benjamin mentioned, we are still learning about this, and particularly about long COVID. But we'll learn about new variants as well, and we'll learn about new vaccine recommendations. So I would just encourage my colleagues to really be careful, to not avoid continuing education around COVID, to stay on top of it, because it will change and it will be updated, and it's up to us to stay updated and as educated as we can be, so that we can be trusted messengers about what's next.
Let me encourage people as we close out our webinar today. I want to thank you all for being here. The We Can Do It campaign is very, very important. And I just encourage you to go to the apha.org website and pull down the materials, share it with your friends and family, and everyone be safe out there.
Thank you for all your work.